Liverpool, in northwest England, has become the first city in Britain to mass test all citizens for the coronavirus. Around 100,000 people have been tested there since the scheme was rolled out nearly 2 weeks ago. Liverpool has among the highest death rates in Europe from the pandemic. The hope is that mass testing will help to break the chain of transmission by identifying asymptomatic carriers. DW's Charlotte Chelson-Pill reports.
This is being billed as the UK's latest weapon in the fight against COVID-19, with the city of Liverpool on the front line. They're piloting a city-wide testing scheme, the first of its kind in the UK. And a massive PR campaign's underway to enlist the 500,000 people living in Liverpool.
The more people get tested, the better we can protect that great city and drive the disease down.
Let's start the fight back against COVID. Let's get tested. Let's do it together. Let's do it for Liverpool.
Local authorities have set up dozens of testing sites across the city, and they've brought in the army to help.
The logistics considerations of this operation have been significant. We deployed 2,000 troops to the city of Liverpool within 3 days across 45 sites.
Liverpool volunteered to try the mass testing operation after recording one of the highest COVID rates in Europe. Authorities hope that by testing as much of the population as possible, they'll identify more asymptomatic cases and break the chains of transmission. The scheme has tested over 100,000 people since it started a week and a half ago, but there's still a long way to go.
We haven't been yet, we haven't had the time, but we will. It's a good idea, though.
I've had mine done, and both me and my husband were negative, but I think to get the whole population tested, you'd be able to identify who's got it, particularly those who have it and don't show any symptoms.
But it's important. It should be happening everywhere, not just Liverpool. I hope it works and it takes off, yeah.
Processing tests quickly is the key to a scheme like this. Asymptomatic volunteers, myself included, are asked to do the swab themselves. You get the results on your phone within an hour. These are the lateral flow device tests that are being used at testing sites like this one across Liverpool. Now, a lot like a pregnancy test, they can determine results in 20 to 30 minutes. And the benefit is the results can be processed right here at the testing sites instead of in a lab. And that's why these tests are the backbone of Liverpool's mass testing scheme. There's some dispute about how many positive cases are being missed. Critics also fear that getting a negative test could give people a false sense of security. That result's only valid until the moment you leave the building and are once again at risk of being exposed. But local councillor Paul Brandt says this scheme was never designed to be a silver bullet.
We need to explain to the public that this is not a passport to misbehave. This is part of the jigsaw of wider public protection.
It'll be difficult to tell what direct effects this scheme has on cutting infections. It's happening while England is in lockdown. But Paul Brandt says every asymptomatic case that's identified is a step in the right direction.
As we've identified through that programme, 527 people who we now know are positive, who had no symptoms and would not previously have known that they were symptomatic and infectious. And they now can take steps to take themselves out of circulation and protect themselves and their family and their friends.
Originally planned to last 2 weeks, this pilot's likely to be extended, with increasing public engagement top of their priority list. But it's a blueprint for the UK's testing strategy, and the government's already announced more mass testing schemes in dozens of locations across the country.
To Italy now, which is struggling to cope with a second wave of the coronavirus. On Tuesday, the country reported more than 700 deaths. That's the highest daily death toll since April. During the first wave 6 months ago, hospitals in Italy were quickly overwhelmed and a record number of people died. Now, healthcare workers are terrified as they may face the same battle again.
Another patient with COVID-19 being rushed to hospital in Monza, Lombardy. This region was the epicenter of the outbreak in spring, when Italy's healthcare system was overwhelmed. Now, once again, Lombardy is the hardest hit. But the volunteer rescue workers say this wave is different.
This
month we've seen a repeat of what happened in March. The difference is that we've also seen young people with COVID-19. In March, it was mainly elderly people. Now we have young people too. To try to contain the spread of the virus, many regions have shut down. But healthcare authorities say a nationwide lockdown might be necessary soon if the situation doesn't improve. In Lombardy, mass testing facilities are now being set up. More than 30 drive-in testing centres are being planned in the region, each able to test hundreds of people a day. And authorities here say the measures are helping. The reproduction number appears to be sinking. But the number of people in intensive care is still rising, and many hospitals remain understaffed. Some 5,000 doctors are needed in Italy at the moment. Another young patient is being picked up. The woman in her 40s needs oxygen immediately. For the volunteer ambulance workers, she's part of a seemingly never-ending stream, pushing them to the limit.
For more on this, I'm now joined by Giacomo Grasselli in Milan. He's the coordinator of the intensive care unit network in Lombardy, the region in Italy that we've just seen in the report and that's hardest hit by the pandemic. Dr. Grasselli, the world watched as Lombardy's hospitals were overwhelmed during the first wave. What's the situation now?
Well, the situation is, I would say, slightly better than March and April. So, to give you some numbers, we had a maximum number of 1,500 patients admitted at the same time to the ICU for COVID-19. Our ICU bed capacity before the crisis was 750. We have now 910 COVID-19 patients, and with the restrictions that have been implemented, we hope that we will not overcome 1,100, which would be important because the number of non-COVID patients this time is quite higher. So certainly the system is under stress. We do not have problems with the availability of personal protective equipment and technical stuff like ventilators, as we had last time. So this is better, of course. What is different now is that healthcare workers are really, how can I say, tired. And so it's very heavy to work in the COVID units. And it's probably more difficult to open new beds, but we're doing it. And again, we are granting to every patient who needs an ICU bed, So I think that we're doing a good job, but again, certainly the system is under stress. But I would say...
Can I ask you, excuse me for interrupting you there, what did you learn? I mean, it's different this time around, but did you learn something in the first wave that you can apply now to do things differently this time around?
Well, of course, first of all, from the organizational point of view, we know now where and how to open new beds. So we are repeating many of the strategies that we had implemented in March and April. Again, we were not unprepared from the point of view, for example, of personal protective equipment and of the training of the personnel. So now everyone is trained on the proper use of PPEs, and an adequate number of PPEs are available. And from the clinical point of view, we have learned something on how to treat the patients. And so hopefully, I think that the mortality in ICU would be lower this time than in March and April.
Do you think the summer months were used wisely to prepare Italy for a second wave?
No, I mean, not really, but they weren't exactly as happened everywhere in the world. So I speak to my colleagues in other countries, and they all complain about the same things. It's very difficult if preparedness means opening a huge number of new ICU beds, I mean, not temporary ICU beds, but real ICU beds and staffed. it's very, very difficult to do it in few months, of course. Maybe, you know, we are still in lacking doctors and nurses. But again, it's not so easy to recruit new personnel during the summer season. What we really didn't do very well was that probably the information to the people was quite misleading, like that there were experts or so-called experts who you know, went on TV, on the newspaper saying, okay, everything is over, so you can do whatever you like. And so people did not really follow the rules. And again, this is what happened everywhere in the world. So this is the reason why this second wave is so huge again.
Giacomo Grazielli, we have to leave it there. Thank you very much for joining us here on DW News.
Thank you very much. Thanks. Bye.
Now let's take a look at some of the other developments in the pandemic. Poland has reported a record 603 deaths related to the coronavirus, as its health service also struggles to cope with a second wave. Experts are urging Japanese authorities to step up preventative measures after Tokyo reported 493 new coronavirus infections, the biggest daily increase seen so far. And the US Food and Drug Administration has approved the first COVID-19 home testing kit for home use that provides results within 30 minutes.
For as much as it is strict, Austria's lockdown is also ambitious. It is supposed to slow the spread of the virus significantly and be followed by a mass testing program. The goal, to test everyone, all 8.8 million people in the country. So much of Austria's lockdown depends on public cooperation, and that is true everywhere. When everyone is not on board, the consequences are the tragic scenes now playing out in the United States. The Austrian Prime Minister has issued one urgent request to his nation: don't meet anyone.
Vienna's commercial district was full of people on Monday night. Locals want to shop before the lockdown. Since only grocery stores and pharmacies can remain open during the next 3 weeks, home goods and electronics are especially sought after right now. I'm looking for a camera for e-learning for my son so that he can take part in live online lessons. I'm looking for everything that I need. I don't know how long the lockdown will last, supposedly until December 6th. Apart from shops and restaurants, schools and daycare centers are also closed from Tuesday. But here in Vienna, many establishments offer childcare for kids with working parents or those who can't take part in online classes at home. She was with me the whole time during the first lockdown. Sometimes I had to have a Zoom conference, and she was sad the entire time. She's an only child. She doesn't have anyone else. There are exceptions to the current curfew. People who must work in person, visit a doctor, or buy groceries may leave their homes. Going for walks and exercising outdoors is permitted, but only with social distancing. And there might be more signs of life outside than there was during the spring's lockdown, because this time, playgrounds and parks are staying open.
Well, correspondent Steve Shade joins me now from the Austrian capital, Vienna. Good evening to you, Steve. This partial lockdown, we know, did not work. Now it's the lockdown on steroids, you could say. When you look out your window, can you tell the difference?
I certainly can. Today, things are very tranquil. When the lockdown came into effect, things did shut right down. And the contrast to yesterday was amazing, because the lockdown was announced on Saturday. So everybody got ready for Monday and stormed the stores. There were lines out the door, not everybody wearing face masks. So it immediately became apparent why the lockdown was necessary. Lockdowns work. They're not popular, but it's what it was required. When people were left to their own devices, the infection rates were off the charts, and we're still seeing the effects of that. Nearly 6,000 infections just over the past 24 hours. Intensive beds, the intensive treatment centers in hospitals are in danger of being overrun. I think Austria only has about 522 beds left. Switzerland hit capacity today. It needs to be stopped.
The government plans to also test the entire population when this lockdown is finished. Talk to me a little bit about the logistics here. I mean, this sounds like a job for the military.
If Austria were to follow the Slovakian model, it would indeed require the military. Testing more than 8 million people would be a monumental task. But Chancellor Sebastian Kurz is going to convene a meeting of experts tomorrow morning at the Chancellery. And even ahead of that meeting, what's now coming out is that what is more likely is that some sort of targeted testing will be pursued. What they did in Slovakia was they used these antigen tests, which are not very accurate. And they're not really meant to test populations where you're going to have a lot of people testing negative. It's good to prove that people were positive, but it doesn't accomplish what you need to accomplish to find out where you have clusters and why they built. The big mystery in Austria is why the infections started to increase so rapidly in some areas. So this mass testing program will be clarified after this big meeting tomorrow. Whether Austria pursues the Slovakian model is yet to be seen, but probably not likely.
Okay, correspondent Steve Shade with the latest tonight from Vienna. Steve, as always, thank you. All right, we're going to stay in Austria now. I'd like to welcome virologist Norbert Novotny to the program. Dr. Novotny, it's good to have you with us. The partial lockdown did not bring down the number of new infections. In your medical opinion, is this total lockdown for the next 2.5, 3 weeks, is that the right solution?
First of all, good evening. This partial lockdown for almost 2 weeks now, at least it plateaued the new infections, and we see some decline in the last 2 days. So I'm pretty sure that this complete lockdown, this hard lockdown during the upcoming 20 days, it should work as we saw in other places like Israel or the Netherlands, Belgium, Czech Republic. So there are a number of other countries which successfully, where the hard lockdown worked successfully. And as we heard, it is absolutely necessary, but I think we will manage regarding also hospital capacities and especially capacities in the ICU.
What about after the lockdown? We understand that Austria wants to test the entire population for the virus. Do you know, maybe you could explain to us, will these tests be for the presence of antibodies, or will these tests be for the actual presence of the virus?
No, I think the idea is in the last few days of the lockdown to test for virus in order to quarantine those which are still infected. In order to save, the last 2 weeks before Christmas for shopping, etc., and not to start again with, a lot of virus circulation during that time. Although I think probably it will not be the entire population. As you also said before, I more think it will be targeted to some certain groups of people. For example, teachers, because what it definitely will do is the lockdown is until 6th of December, and on the 7th they will open, and especially also the schools will open, including the school for the people aged 14 to 18. And testing the teachers will make sense, and some other groups.
Dr. Norbert Novotny joining us tonight from Austria. Doctor, we appreciate your time and your insights tonight. Thank you.
Most welcome. Bye-bye. Have a good night.